Hello, everyone, and welcome to the event for our Black Maternity Health Week panel. Today, we'll be having some panelists speak about Black maternal health. But first, I wanted to introduce MOASH as well as MyRec. And so, MOASH, or the Michigan Organization on Adolescent Health, mobilizes youth voices, engages community partners, and informs decision makers to advance sexual health, identities, and rights. And the vision is that we see a society that respects and celebrates youth identities, advocacies, and informed voices. And so I'm one of the many other council members that sit on MyRec, or the Michigan Youth Racial Equity Council. It's a council of a youth-led project where people between the ages of 13 and 24 receive education, support, opportunities, and resources necessary to become better leaders and advocates addressing important issues related to racial justice, sexual health education and services, and of course, reproductive justice. And of course, why we're here today is the Black Maternal Health Week panel. And so we watched a film previously in February, and we decided to do a deeper dive. This week, we are celebrating Black Maternal Health Week, an annual event that runs from April 11th through 17th, founded by the Black Mamas Matter Alliance. This week aims to raise awareness about the disproportionately high rates of maternal mortality for Black women in the United States, advocate for policies that address the root issues of these disparities, encourage stakeholders across different fields to take action to prioritize Black maternal health. And so we have a few different panelists here today, as well as attendees and different council members across MOASH, and we'll be asking questions to our panelists. If everyone could please introduce yourself using your name and your pronouns and your role. Again, my name is Renee. I am a council member on MyRec, and I use they, them pronouns. But before we get into questions, we want to allow the panelists to give a brief background about themselves and the work that they do. We can start with Jacqueline.
Thank you, Renee. It's just good to know that we have all of these resources for you young people. I just remember growing up and we didn't have all these resources at our hands. So it just feels good to know that you guys have or can get things that you need. So again, my name is Jacqueline Cook. I work at the University of Michigan Health Center, known as Michigan Medicine. I am in the labor and delivery department. I've been there for the last 5 years. I served 2 years as a bedside nurse, labor and delivery nurse. And then I am now 3 years into being their supervisor. Again, I've been at the U of M for about 35 years. I first started here at 16 years old because I was a teenage mom and I needed a job and a way to support my son. And plus I knew that I was going to head my career into nursing. So got me a job at the U of M to help support me and my family. And that is about me. For the last couple of years, don't mean to go back or all over the place, but for the last couple of years, last year was our first year starting the Black maternal health at the university. So this is our second year. I am very excited that the U of M recognizes that there is a difference in healthcare between white and Blacks, and just here to close that gap. So thank you.
Thank you, Jacqueline. And I believe Erica.
Hi, I'm Erica, and my pronouns are she and her. I am a full spectrum doula, which means that basically I support birthing persons from their prenatals all the way to the postpartum phase, usually into what we call the fourth trimester also, which is like that 3 months earth side, and also pregnancy and infant loss and abortion. So I do support with any pregnancy outcomes that there might be. I am currently working with Birth Detroit as the community organizer for maternal support systems. I do lactation support, and I'm a Lamaze certified childbirth educator, and I am thrilled to be here with you all.
thank you both for sharing time with us today for the panel. Um, if we want to get started with some different questions from the council members, that'd be great.
So I can go first for asking questions. My name is Catherine Lee, and I'm part of MOASH, and specifically my REC. My first question is, how do you define birthing justice?
Erica, are you taking that one or me?
Um, I will give my version or my view of birthing justice. Birthing justice is access, equitable access to the birthing experience that you deserve. Maintaining your dignity, maintaining your autonomy, your choices, knowing all of your options, and being able to safely chase the birth experience or pregnancy, perinatal experience that you want, that is best for you. And that is birth justice. Revolutionary and going after it, having it by any means necessary.
I do agree with Erica, and just to piggyback off of that, at a nursing aspect, birthing justice to me is when everyone is, well, when you come in and you're getting the care that you need. You're being listened to, not only being listened to, your advice about your body is being accounted for, and what you choose to, or how you choose to birth. Birthing justice is making sure just not Black mothers are giving the same opportunity as a Caucasian, but they're educated as well. I think sometimes that Black people, Black maternal mothers, where we don't have the education that, or did not, or have not received the education that we need. So I'm a big person on making sure that my mothers are educated, because that way they are able to make informed decisions. And that to me is birthing justice, because we always making sure that we explain and explain and explain. And I know that sometimes when we're dealing with African Americans, it's hard to explain, but keep pushing through that barrier. We do need the education again, so we can make better formed decisions, and that's what caused us to have birthing justice.
Thank you so much for your answer. That was really thoughtful and I loved it. My second question is, have there been instances where racial biases in the healthcare system have negatively affected patients that you can share with us? And if so, how did you respond to those instances?
Okay, well, I'll go first on this one. Maybe about 3 years ago, right before I became right as I was transitioning, to be a supervisor, one of my nurses came to me and said, "Jackie, I need a patient wants to talk with you. She's just having some concerns about her health care and how she's being treated." And I had sort of already heard about this young lady. A lot of people, especially in the nursing or the medical world, well, you'll get, try to give you your feel of what the patient is like, and, and tell you this and tell you that. But, I was always, and I am the kind of person, and kind of nurse, that I want to judge my patient or listen to my patient for what they have to say, not for what someone else has to say. So long story short, I went into the young lady's room, and she was concerned. She was a mom that was an auntie, meaning that she was not ready to give birth, and she needed to be in the hospital with us for until she was ready or of a certain gestational age to be able to give birth without a demised baby. And so anyway, I'm talking with her, and she's telling me that how she feels like she's not being listened to. She feels like she's being biased and judged because she's been here before. She had been accused of trying to put herself in early labor or break her water. So she had all these barriers that was against her. And she was really concerned because she was bleeding, and she knew that she was abrupting. So the backstory to this young lady is that she had 8 children. She was a young Black woman, not financially secured. So she had some economic issues and educational issues. But the one thing about this young lady, she knew her body. So I went out and talked to the providers, and we got them to come in and to talk with her and to do an ultrasound. And as this was the most enlightening thing that I have ever seen a patient do. But it was beautiful the way that she even did it. So we're in there. The doctors have the ultrasound. They're looking, and the mom, as the doctor was trying to explain to her, the mom just started like sort of going over the doctor in a respectful way and started pointing out on her own ultrasound where the abruption was at and what was going on and how she was feeling. And the doctor sort of tried to negate it, but she couldn't after she sort of looked, and then a colleague said she's correct. And so, that just goes to show that sometimes, just have certain biases or history with the patient, you cannot not listen to them, even sometimes in the moment. So long story short, they ended up having to give her a C-section, which she thought that would happen anyway. She ended up being correct, and it was just an experience that where I witnessed where the doctors, the providers actually did not listen to the patient, and it wasn't until I stepped in and we insisted that they do this to make sure that this lady was not in harm. And had they kept on and ignored her, she could have, completely abrupted, bled out, lost the baby. It could have been just a horrible, outcome. But I'm glad that we were there, we advocated, we spoke up, we didn't take no for an answer. And we wanted them, if you don't think that this is it, then prove it to me that it is not. Then that way, as a mother, as a nurse, we can go on with confidence just to know that, okay, the baby and the mom is safe. So that was my experience.
Thank you. I will say I have seen bias and assumptions made. Specifically, something that really sticks out is with skin color. And I'm not sure if all of you know about what jaundice can look like in people, where it's kind of that yellowing, you can see it in the eyes and skin. And one of the babies that was born with one of my clients, the baby did develop jaundice, but the staff did not really think that was something that she should be concerned about, that mom should be concerned about, because the baby, that was just the baby's skin tone, or there are lots of different hues, and these were people who were not quite as melanated, who were talking about skin color and what it should look like. Well, to this mom knew that there was just not something right. And so when they actually did do blood tests, they said, oh, they could see that, oh yeah, there were high amounts of bilirubin in the body. And so the baby was in fact jaundiced, but they were writing the baby's condition off because they just didn't really see that they were doing a very superficial look at this baby's skin color and putting the baby in danger in that way. And so I was really excited that the mom knew what to look for, because she did take the class. She did have childbirth education, and she knew what to look for. And she knew that the baby had not pooped for quite a while. And sometimes what happens to alleviate jaundice, in addition to light therapy, phototherapy, and other things, is to get the food or get the stool out of the baby and keep the baby eating. So she knew some things to look for because she had that education. Yes, thank you, Jacqueline. But I just thought that was a serious miss on the part of, even though it was superficial, and even though they did dig a little deeper, it could have been a much more serious situation had they convinced her that it was just a matter of different skin tones.
Thank you all for the answer. I only have one question left. This is about the future. So my question is, how do you envision the future of maternal health care for people of color? Furthermore, that of any other marginalized groups.
Well, I envision it to be equitable. Equitable care for all, no matter what color the skin, standard of care for everyone. I think that is very important. But it also is important to recognize differences because although, racism is a whole nother level, but there are cultural differences that should be recognized and respected. With keeping that in mind and having acceptance, I just believe the future will be where all is getting the same health care. We're all speaking the same language of love, that maternal mothers matter. I just believe that, again, just as we have turned the time of just racism within the, our society, we're going to continue to do that. And even in this, and we're going to level the playing field so everyone is recognized. And again, everyone is getting good health care.
The future, access to all kinds of birth, whether you want to birth in the hospital, if you want to birth at home, if you want to birth in a birthing center, how do you want to birth? What kind of care are you going to get? You're going to get the care that you deserve, that you need. A safe birth. You're going to have midwives. You're going to have nurses, anyone that you need, whatever and however you want to birth, that is how you are going to have access. And you're going to have access. And the people who are helping you facilitate your births are also going to be able to have sustainable living so that they can serve you and give you all of the care that you need based on no matter where you are. What are your needs? That is what you are going to have access to for your birthing experience.
Well, thank you so much for all your answers. I think I'm gonna pass it to the next person to ask their questions. Thank you.
Thank you, Catherine.
Hi, I'm Anamika. I'm a council member at MyRec, and I use she, her pronouns. So I had a couple of questions for you guys today. My first being, how can an individual healthcare provider better advocate for Black voices, specifically someone who's like younger or less like experienced in comparison to the other people involved in the like case?
So that is what, oh, I'm sorry, Erica, you go ahead.
I'm going to come with my perspective, and then I'm just going to sit and listen to your perspective.
Yes.
What I do in those that I've helped who are young, Black, and when I say young, I mean young, is to not discount their experience, because that young person in the room may have more experience going through their journey than the people who are there to facilitate. So I like to sit and center them, ask them questions, educate. And I would say to the health providers, the expert in the room with the medical knowledge is the provider. The expert person in the room based, and with that experience who's going to be making decisions is that young person. And I want to protect their dignity, and I want that provider to do all that they can to protect their dignity, give them the education, give them access to resources so that they can know all of the information that they can possibly have to make the decisions best for them as they keep going. Don't treat them like they are, don't treat them like they don't know what they're doing. Give them tools to give them the best opportunity to make their best decisions with dignity and integrity and honor, and make sure that you're honoring and lifting that person. Black, young, understand that the world is going to see them perhaps in a very undignified way, undo that, change that, and be their safe place. So that's what I would want to say.
Good
Yeah.
perspective, Erica. Good perspective. My perspective on this is it doesn't matter your age. Again, like she said, if you have the wisdom and the knowledge, speaking up, an old person who know anything, they'll sit and listen if you're doing and saying the right thing. So one thing that I would encourage is to listen to understand. That is a skill set, which is the best tools in advocating. In order to be advocating for a Black voice, you have to listen. And what are you listening for? You're listening for your patient's, that mom's or that patient's concerns. You're listening for their plan of care, because moms come in with an expectations, and rightfully so. Just like Erica says, they have the right to birth how they want to. When, I can't say when they want to, because babies come when they want. But they have such a vital say-so in their birthing process, and should. Their voices should be heard. They should be concerned. Not only that, you want to listen to their experiences. You want to listen to their fears. Not only that, you want to know what their knowledge base is, because if this their first time experience as a mother, then you know that there's a different level of education that you need to make sure that you're implementing into this birthing process plan. If you got a mom who's given birth, twice or three times, she pretty much can pretty much birth her baby, but again, you want to know that their knowledge base is. You want to listen to understand, making sure you have just negated your biases, your judgment, and even your fears in this. Understanding the Black voice. Gain knowledge to help better care for the individual. A person will tell you all who they are, especially I've been nursing for over 20 years now. And when I walk into a patient's room and I begin to talk to them, I begin to listen to them, because I'm listening to see what kind of person they are, what personality that they have. I mean, any good skilled healthcare worker will do that, because that also tells you something about who the person is. When I was in my cardiac career, I one time remember taking care of a patient, and he was like really he was a man's man. And so but he was in a very vulnerable position at this point, because he had open heart surgery. He could barely do anything for himself. But because I listened and paid attention to who he was, I knew that I had to approach him differently in my aspect of care, because of who he is, the level of integrity that he has. And I think that that's important too when you're taking care of a Black maternal mother. And if you know anything about Black mothers, we are dignified to certain degrees, and and we like to be treated with respect. We like to be heard. And not only in just being heard, but just knowing that you can follow through. And then when you do that with a Black patient or even a patient, it builds a certain level of trust. And if that's what you want in healthcare, that's what you want to practice as a provider. You want your patients to trust you, because when they trust you, they open up to you. And then when they open up to you, you're better to be able to address their issues and concerns and be able to take care of them as a Black patient, because now you have gained to understand them and you've gained their respect. And that's my feel on it. So listening to understand, it validates that Black voice. It validates that she's been heard. It validates that you are advocating for her, and that she knows that she can sit back because you got her back. That's my take on that.
Thank you guys so much. I wish every healthcare provider in the world could have heard that. It was so amazing. So my second question is there any research currently that you guys know of happening aimed at reducing or even just understanding the general impacts of Black maternal mortality? And then if so, what that research kind of looks like?
Well, I'm going to say this on my level. I actually looked for articles. The CDC got information, but their information are from 2016. I looked at the Cochrane Library, and a lot of it's just general. So yes, there are tools out there that are, policies at other institutions that are trying to bring awareness to Black maternal health. I will say when I looked through the U of M actual databases and policies, I did not find anything. What I found was a standard of care. So I think that is what you need, and that's a policy where again, everyone is getting the same health care, because this is the regimen that we're following as a standard of care to what we say when you come into our hospital. This is your Bill of Rights. This is what we have for you. So we don't identify it as just directly for Black maternal. Will they? I'm not sure, but I just do know that there is information out there that is bringing Black maternal awareness to the forefront. We do have certain committees, as such as the one that we just started a year and a half or a year ago, Black Maternal Health. And then we got DEI. I know that everyone has heard of DEI. So that we got programs, and and then there's things in the community. But to just say that we have all right policies, not yet. But if you choose the right one, I'll help you back up on that.
Yeah, you're right. I haven't seen specific organized, well accessible, easy to find research on Black maternal mortality. What I have seen is there are a lot of quality investigations around lots of different maternal health programs, lots of things in terms of what is the quality of lactation support in different hospitals, from the individual hospital to the system. What is lots of surveys in terms of quality of care. As you have an experience, I know Lamaze has surveys that they send out, that they actually have birth support, their educators sending out, so that they can get feedback and to add to their research, to their data, to feed how to best serve, especially Black women and Black birthers. But as far as the mortality, I have not seen as many accessible data points for that, for families that are here who are survivors of Black mothers who have passed.
Got it. Thank you guys so much. And then for my last question, what can we as individuals, and then especially us as youth, do to support efforts to address Black maternal mortality, but then also just in general uplift voices that are often put down?
Acknowledge that it is happening, acknowledge that it is real, acknowledge that there are disparities and discriminatory practices, that there is obstetric violence that is leveled against Black birthing people, and that it's uneven. There's an uneven hand in that, how it's dealt. How do you support? Educate yourselves. Sitting here, asking these questions, getting answers. So when you have the information, you can also go and share that information with your peers, with your families, with the people that you know. You can take this information and you can share it. But education across the board, you do not have to want to have any children. You do not have to be a maternal person. You can be a caring human rights advocate. And this is how you do that.
Wow. Erica, I can't even say anything. You said it all completely, just with that. And the biggest thing and the biggest part, if I have to piggyback off of that, is education. The more education that you have, each one teach one. So you can pass that along. And when you're educating someone, especially with Black maternal health and about who they are and their condition, it just shows who you are and shows that you care. So again, education, I don't know where you guys are gearing your careers at, but medical field, we need you. We're going to need nurses in the future. So, hey, if you really want to get your feet wet, hey, start gearing your career towards coming into the medical field in obstetrics. There's a lot going on. We are learning that, or in this day and time, we have really high risk patients. Mothers are sicker. More conditions are happening with moms. So we need you all on front end. So that's what I would say, educate.
Got it. Perfect. Thank you guys so much. I'm gonna hand it over to my fellow member and just thank you guys for taking the time to answer my questions.
Hello, my name is Janaya Howard. I attend Indiana University, Bloomington, and I'm originally from Saginaw, Michigan, and I am a council member. Yes, Saginaw. I'm a council member for the Michigan Racial Equity Council. So, first, I just want to thank you, lovely ladies, for being here, and taking the time out to educate us. I think, especially as a Black woman, this information's just so effective for me to know and to just spread with my family and to just keep in the back of my mind to build on as I get older and start to have children of my own. So going off of that, my first question, I know we talked about a few strategies, like listening to understand and educating yourself, but are there any other strategies and initiatives that have been effective in addressing implicit biases like pain normalization and stereotypes within healthcare systems to improve outcomes for Black mothers?
That's a loaded question, young lady. But a good one. What a good one. What strategies and incentives are we using? Well, I thought about this question, and I came up with three points. My number one point was sticking, and I'm talking on an institutional level, coming from the VBWH Birthing Center. Sticking to the mission and values of the institution. I think that's a strategy, because that they're put in place for certain reasons. They're put in place for equity. They're put in place to keep us grounded in what we believe in, what we're doing, and the care that we're giving. Number two, I would say following standards of care. Going back to that. That's why they were instituted or instated, is to practice what you preach, and we practice off of evidence-based practice. And so sticking to a standard of care, not only does it have you to treat the patient, and everyone gets the same amount of care, no matter what skin color, no matter what's going on, when you stick to that practice of who you are, because that, I think that me as a 20-year-old nurse, I treated my patients equally. And let me say that. My take was, this is someone's family member. So I treated them as if they were my family member. And so that's what I say about sticking to the standard of care. I never deviated from how I treated a patient. Or the care that I gave them. If my patient was in a crisis, I remember spending 12 hours at the bedside only to leave just to maybe, scarf something down or to use the restroom, but right back at their side, because I want to make sure that they're getting the best care in this crucial situation that they are in. And same thing with birthing. When a mom is birthing, you want to make sure that she is getting the best care, the best knowledge, and her freedom. Again, like Erica spoke of her autonomy, making sure that she has at her fingertips what is available to her, resources. And then back to my point, you said other than education. My last point is education. It's a big thing. U of M, they are just now, to a certain degree, over maybe the last 10 years, are starting to recognize that there is a difference in care when it comes to Black people. So now we have programs such as, again, the DEI, diversity, equity, and inclusion. We got community outreaches that we're doing with that. We have programs that now are starting to, evolve. Even in leadership, they're giving us different aspects of how to, well, they're just learning how to, deal with African American, but on how, the differences between us. And it's just a beautiful thing that is now that we're talking about it. And it's because it's already been recognized, but now we're talking about it openly. We're talking about what we could do, should do, to just bridge these gaps in healthcare. Again, because we are all equal. We are all the same, no matter what. The only thing that differentiates us is the color of our skin. But even in that, we are still the same. And if we embrace and accept, we can change. We can continue to implement certain things that will, again, be for the better care of our mothers.
Okay, so what can I say after that? Not too much.
Erica, we a team, girl.
I know. I think what I want to lift is something like, I know this sounds maybe obvious, but Black Maternal Health Week. We have these things that we can identify, not to separate, but to lift and to acknowledge and to say, hey, we understand that we're all here and there is a special need and a special group that needs you to ask, what else can we do for you? Whether it's Black Maternal Health Week or Indigenous Maternal Health or Latina maternal health.
Yes,
Any
yes.
of We have lots and lots of different cultures that experience different traditions and different practices. And we need to say, what do you need to have an equitable birth experience that is bringing joy? I talked about this with Jacqueline earlier this week.
Mm-hmm.
What can we do to protect your experience to maintain joy? And that may not look exactly the same for everybody, but right now what we're doing is we're sitting down, we're asking people to sit down and listen and then walk away and make changes.
Yes. Yes.
Well said. Jacqueline, I love that you brought up U of M because my best friend, she just got into U of M and she's going into neuroscience as a Black woman. So that's
Hey,
yes, I'm super
that is
excited.
beautiful.
I'll
Beautiful.
be connected. I'll be like, I know someone. She works there.
Yes.
Amazing.
You're more than welcome to contact me.
My next question, kind of speaking and going off the change that we were talking about, in what ways can interdisciplinary collaboration occur between medical professionals, researchers, advocates, and policymakers that will create that change that we're envisioning for the future?
Is it my turn? Okay, well, I can definitely say, as far as policymakers, the things that you just seen happen in the past week with the omnibus bills being brought to the floor, which basically expand support and access to different kinds of health professionals for, perinatal care. Also, in one particular experience, you'll have lots of different disciplines. And when they are in communication with each other to see how can we best support, after listening to a care recipient and saying what they need, have a team talk and get out of the silos. What kinds of doctors, what do you need to do? The pediatric dentists need to know what the pediatricians are saying because that may have an impact on lactation and breastfeeding. And if you have someone who is an orthopedic specialist, there are a lot of physiologic things that occur during a birth. What kind of care can that care recipient get based on what the obstetrician who is listening say, you know what, here's someone who might need this kind of support for alignment and for just physiologic changes or support. talk to each other. And as far as policies go, we need to make sure that we are holding our legislators accountable for supporting and putting things into place that are going to sustain access and who are going to sustain the people providing support.
All that Erica said. No, I'm teasing. So, Erica, very good points. I think when you take all of this, when you take medical professionals, researchers, advocates, and policymakers, you put us all in one room. We still got one person that's missing out of this, and that is the Black maternal mom themselves. Because no better person to also help you to collaborate this with someone who is actually experiencing this. So I think that's just one piece of person to the puzzle there. One person that needed to just be added, because the policy is going to be built off of her experiences and what has happened with her. So no better person to have than that. I know one thing our unit has done to help. This is just something we're just doing across with just medical, providers and nurses. We have come together where we, at least once a month, we have a dinner. And at that dinner, what we're discussing is what can we do to make healthcare better. And at this point, yeah, they're doing it for a broad spectrum for our whole unit and our whole population. But it's a start. And that's where you can start at as well with Black maternal nurses, is that making sure that the professionals are on the same level of care. Because, again, if we're not on the same level, how can we help anyone if we don't agree, And that's even with our midwives, our doulas, because I'm a very much advocate for them being involved as well. Because they are going to make such a difference, because I will always say this, and my doctors know I say this, they're midwives, and not to discredit any doctors, like I know that doctors are amazing, but there are places that midwives and doulas can get in with the mother that a provider may not be able to. So it's a special skill, and again, not to say that they don't have it, because I've seen excellent providers at the bedside. But I do know for a fact that all parties need to be involved. Even the families need to be involved. The fathers of the babies need to be involved in this, because the reality of this, all of this is going to affect them as well. And coming up with policies and stuff, again, I think it takes outside voices as well to help us create these policies, the better care for our Black maternal moms and prevent the mortality rates that we are having.
Can I say something in addition to what you just said? Because you were spot on, and I kind of said it, but I think that you hit it so much better than I did. And that is, before you start to do anything, and it kind of goes into the next question, I'm sorry. Before we start the planning, absolutely right. Don't take it into the conference room. Take it out into the community and be invited by the community to sit and listen. They're the ones that need to talk first. And the community does include Black mothers. It includes Black birthing people. It includes fathers. It includes partners. It includes, the grandmothers who might be the ones who are raising the baby.
Yes.
It might include, the godparents who are the ones who that baby might be going with them before they go to, their homes. It might be foster parents who are in the community that want to have, the best strategies to have this baby who, they're working to have reunified later on. The community is the one who needs to help set the standard and set the tone. And then those with the educational and the skill sets, they're the ones. So I thank you so much for saying that person needs to come first, because it's true. And I think that room needs to be outside of the hospital first.
Yes.
I agree. No, I think that's a very valid point. I think we saw that when we saw Aftershock. It's something that I didn't really take into account how many people are affected when there's a death like that and just how many people are involved in a birth. And so to have all those voices at the table is definitely very essential. And I know you two already touched kind of on the next question, but if there's anything else to add, um, the question is, are there policy reforms that can help address the racial inequity in maternal health care?
Well, again, at this point, I know that the U of M doesn't have an actual policy. I actually searched again the database just to make sure. But again, they don't. But we do have programs that we do have implemented. We have something called BEAM, but it's not necessarily for Black maternal, it's just for Black individuals at the level at the U of M. And then we have a program called BASE, and BASE is just, it's very general. It's for everyone, but it also just recognizes the inequity that we have in healthcare, but no direct policies at this point.
Yeah. Or sorry, Erica, did you want to chime in?
Oh, I was just gonna say I hadn't seen, you know.
Yeah.
And I'm pretty sure we'll get some written.
Yeah.
Hopefully, we're praying.
We will.
I think with like education and starting even here and just providing that education and spreading that awareness, honestly, will create, and hopefully we are the generation that really pushes forward with change in this. But the next question, I know we touched on midwives a bit, and it's funny because I actually have another best friend who's also Black, who's going to college to be a midwife. So
Beautiful.
a lot of friends in the medical field. Unfortunately, that was not me. I'm in interior design, but the question is, how can we diversify the healthcare workforce to ensure that the Black community is represented among OBGYNs, midwives, nurses, and all these other medical positions? Yes.
I know one of the most interesting experiences that I had was at the Black Health Fair that was a few weeks ago. And I was representing Birth Detroit, and I had a pelvis there, and I had a little baby there, and lots of questions that I could, that I could answer about birth centers and things like that and midwifery care. And I had kids coming around to me, and I said, okay, Erica, now I was a former classroom teacher. I am a former classroom teacher. And I said, what am I going to tell them? But what I did, I was able to take what they knew about birth and ask them questions and say, okay, so what do you know about birthing? And what do you know about this? And when they would tell me, I'd say, okay, so what do you know about different places you can do these things? And we would end up having these really great conversations about things that they wanted to do and how it was connected. And here I'm sitting here listening to you say interior design, and all I can think is, do you know how important environment is in childbirth?
Mhm.
And so it's like, whoa, I can see so many different birth centers who would need someone who was an interior designer to help create an environment that was conducive to having a beautiful, peaceful, safe birth.
Mhm.
So having these conversations, knowing it's not just a medical one, but one about the entire holistic birthing experience, learn about those things now. Um, Junior high, high school, when you have career day, I don't remember ever seeing a midwife come to career day. I don't remember ever seeing a doula come to career day. So having those kinds of conversations now where birth center becomes a part of your lexicon when you are 9, that's where it starts.
So I'm going to tell you my experience. When I first started working at the birth center, I was pleasantly surprised to see that there were quite a few African American women working on the birth center, to the point where I almost did a cartwheel down the hall. And that was just because it just felt good to just see other people that look like me there, and they were professionals. There were several nurses, um, a handful of doctors. I mean, young doctors. It was just exciting to see Black women be so in this field, diversifying it. So when people who look like us come in, honestly, I've heard them say they feel safe. I remember being a nurse, walking in the room, and a few of my patients going, "Whew, glad to see you," especially when I told them I was the nurse. And so it feels good because I actually went to school for this purpose, not just, to be a nurse, but also to help my community as well, to help them to understand, give them knowledge that I can while I'm caring for them. I've been in so many different roles as a nurse, a therapist, a home girl, whatever. It is a beautiful thing to diverse our population that we care for, not just with a Black face, but we need Japanese, we need Asian, we need Mexican, we need that, because guess what? When I have a patient that speaks Spanish and I don't understand her, guess who I'm going to get? My Spanish talking colleague, because that way she can help me to better care for my mother, because now I can understand her. So it's a beautiful thing to walk in and just see different races in this pool, to be able to carry or care for our women, and especially our Black mothers. One other thing I'll say, and I'll be done, because I'm from the community of Ann Arbor, Ypsilanti. I have had the opportunity of birthing my best friend as a childhood best friend. I birthed her grandson. I have birthed my best friend's grandchildren, so my neighbor's children. It's just a beautiful thing that when to walk in a door and you see a familiar face and they start yelling and crying because you come through the door, and they know that they're in good hands.
I completely agree. And I love, Erica, that you brought up the fact that environments have such an impact, because that's essentially, what I do learn. And just knowing the percentages of architects and interior designers, and the Black population of them being less than 5%, and knowing that since there's not a seat at the table for many minorities, and since I have like the privilege to provide these environments and provide these spaces, that is such like an integral time in your life. Birthing a child, it's such a stressful moment, and to just have things that were designed for people that look like you and can understand kind of those things that make you feel safe and seen is such a beautiful part of my career, and is kind of why I do what I do. So that's amazing.
And I'm gonna say this, I'm sorry, go ahead.
Oh, sorry. No, okay. But yeah, I'm glad you brought up that point, because it is just something that I definitely want to do, create change within the world around me.
And for every table that you try to get to, build your own table.
Yeah.
And invite who shares your goals to your table. But don't wait to sit at somebody else's table. Don't bring a chair. Make your own table. Create your own room, because in that space, what you need to get done will get done.
Absolutely. Yeah. And I feel like definitely when there's spaces like that, even attending a PWI, and I've been attending PWIs my entire life, I think you definitely learn how to not let diversity kind of intimidate you. And I feel like me being in college, I am using it to an advantage rather than intimidation. And I feel like it just empowers my designs more and makes me more authentic. Like how you mentioned, like no code switching, it just authenticity. Like people will see you for who you are. And I feel like everything that you do will really shine through when you are authentic. So sorry, I'm kind of getting off topic, but
No, this is the topic.
Thank you. So I have a few more questions. The next one, I know, Jacqueline, you mentioned that holding healthcare providers accountable is something that we need to do. So how exactly would you say that we do hold them accountable when it comes to these type of matters?
Well, I think it depends on the situation, but a healthcare provider should be accountable and know that they are accountable to their patient. We are accountable to make sure that our patient is knowledgeable on the care or condition that they are in and be informed at all times. So, and to me, that is as a nurse, there's a certain level of accountability that I have. But talking to a patient about their condition, their health diagnosis, and their outcomes is actually really a provider, and they do need to be accountable. They need accountability to make sure, and I guess this is something that I have seen at the bedside, not often, but time and time, that a provider doesn't want to be forthcoming or upfront. And I'm like, no, I'm not gonna do it. And it's not that I say that I'm not gonna do it. It's just the fact of it is that's your responsibility as a provider. And I need for you to talk to this patient to inform them of their conditions and what is going on with them. And then as a nurse, I will come in and do my part. And that means that I'm going to implement care. I'm going to start working on whatever situation or diagnosis that they got to make sure that this mom gets where she needs to be. But accountability for everything, especially when caring for Black people. I've had more than number of incidents where I'm in a room either with my patient or my mom, and I might not, well, excuse me, mostly with maybe my family. Let me say this, that I won't tell them that I'm a nurse, and I listen to them and I let them go on. And there's been a couple of incidents where I had to speak up. And it wasn't until I spoke up and started using medical jargon that they started being accountable for what they were saying. And in two different occasions was given misinformation to my mother. And I had to speak up. And I'm like, no, that ain't that. And especially when you could talk, that lingo or that jargon that is to be respected. Is to know that, hey, I matter and I need you to be accountable and tell me the truth about my condition and about what I should be expecting concerning my care, period.
Yep. I want to add something that's kind of culturally sound right now. Imagine Yelp reviews. When you go and look somewhere, if you buy something from Amazon, sometimes you may filter through the reviews. When care recipients start to say, this is unacceptable, this is what happened, this was my experience, and they let everyone know that, then changes are made. Nurses, doulas, we can from the inside do like this. But when patients and care providers start to tell the world, oh, no, that was unacceptable, trust me when I tell you, changes start to happen.
Yes.
Yeah, policies change when people get louder.
I agree. I love that you brought up that point, Jacqueline, because my mom, she's a nurse, and now that you say something like that, like I have so many instances, even now, I'll go to the doctor or I'm getting medicine for something, and she's like, okay, what did they give you? What did they say?
That's right.
Or my grandma will go and she'll be like, I gotta go with her because she doesn't know what she's talking about. And then she pulls out medical terms. I'm like, okay, I don't know what this means, but you so
yeah,
but
you want someone to be able to speak up and making sure that you're getting the proper care. And it was funny because this doctor wanted to diagnose my mother with COVID. And I'm like, she don't have COVID. She got a heart condition.
right.
Go read the paper. But anyway, and it is, but again, I'm very hopeful because things are changing. And things are becoming to be more unaware. And And now is the time. And I'm glad to be involved in this.
Yeah, I'm glad you both are here, and I'm glad I can be here with you and everyone else. The next question is, how can we address the racial biases embedded within the healthcare system? I know we've kind of been hinting at this, but anything on like a micro scale, even like starting within ourselves and like some biases that we might have.
I'm gonna say I always stick to my word, acceptance, because we are different. Individuals, we're different. We're all unique. So when we accept each other for who we are, that will turn around our healthcare. It'll turn around the stereotypes. I mean, I just remember being a young teen mom, having this experience being stereotyped uh, as a young mother. You know, I was told that I wasn't gonna make it, I wouldn't graduate from high school, that I'd probably be on welfare, and I probably would have a bunch of children because I'm pregnant at a young age. And so, you know, and then being Black on top of that. I'm telling you, it was really different when I look back over my life, and I'm like, wow, you survived all that. And I'm a mother still, just of two. I had two children as a teenager, one at 15, one at 19. I've never been on welfare. I graduated from high school before my time. I've been working, exactly, mother. I've been working my job for 35 years. Uh, when I graduated from high school, I was working a full 40-hour job at the U of M, taking care of two children. And you know, put myself through college. Went got an associate's in nursing, then went back and got my bachelor's. And I ain't interested in nothing else. But what I am saying is that uh you know, the stereotypes that we put on, it's not that I set out to break them, but it was just that I wasn't going to let it define me. I had a different vision. I wanted more for myself and my children as a Black woman, knowing that I was going to be up a lot against a lot of challenges. I knew that as a young lady, just not just from being Black, but then here it is, I got to raise a Black young man. That's hard when you're a teenager yourself. So just having all of these different I've fought through a lot of stereotypes. So I can say, from my experience, acceptance. We need to accept people for where they're at, not for where we think they should be or want them to be. When you accept somebody for who they are and where they're at, that person will recognize within themselves where bounds that they want to leap over. And if they want to make their lives successful or not. But stereotypes definitely can harm a person. I think now with the knowledge that we have, and the uplifting that we can bring people, to let them know that you don't have to succumb to being stereotyped, and you don't have to succumb to other people's opinions, especially when it doesn't uplift you. So that would be my opinion.
Oh,
I know, Erica.
Yeah, I know, right? I say acceptance of who's around you, acceptance of the fact that you have biases, sitting with the fact that at some point, and I will speak for myself when I start to make strong statements, accept the fact that because of my biases, I have committed and caused harm. And when I cause harm, being open to listening and hearing what it was and asking, okay, how can I move forward to not cause harm, but to heal? So until the people who are the healers start to really say, okay, but where am I causing harm? Until that happens, they just need to leave the room and bring somebody else in who is asking those questions. So people who are willing to examine themselves and their biases, and it's so hard to get rid of a bias because sometimes our biases save our lives, but sitting and examining that bias and say, okay, is this life-saving or is this harmful? Now, shoot, I think this is harmful. What can I do to be different? I have seen in births, a mother call out her midwife where she felt like she wasn't being heard, where she said, I feel like I'm a young Black person, and if I were, married and white and older, that you might hear me a little bit differently because then I'd be a little bit more like you. The midwife in the middle of this experience had to really sit and pivot in some ways, even if it was just to say, you know what, I'm hearing you, so let me be much more mindful of how we're moving forward because you have to trust me because I'm trusting you. So having to sit with that and hear and accept that you may be causing harm is a key.
That's definitely a really great point. And I feel like it's definitely hard, especially when you're kind of like looking in at yourself and being like, wow, I actually like caused this. And it's like, I know we mentioned providing a safe space, but I feel like when you kind of take in that to account, it's almost like creating a brave space where it's like, yeah, you kind of have to really um look at yourself and acknowledge that you were wrong, but also like be brave enough to, admit your faults, apologize, and learn from there forward. But onto my last question. Is there any ways to truly invest in medical personnel, such as doulas, like we mentioned, that can better address the needs of Black women?
Okay, so give me that last part again. I'll take it first. I was waiting on
I'm
Erica.
sorry.
You're okay. Take your time. Take your time. I'll
Repeat
repeat
it for me again,
Yes.
please, Ms. Howard.
And I'll take it. I'll take it. But repeat it.
Yeah, I'll repeat it, of course. Is there a way to invest in medical personnel, such as doulas, that can better address the needs of Black women?
So that's something that I will go ahead and say. Doulas aren't medical. And I know that that seems a little bit weird and it's hair splitting, but in the medical arena, one of the things that I love it when doulas do is talk to medical personnel because they have a skill set that is unique to ours. And so what we can do is say, okay, some things that you might be learning in medicine, case in point, and Jacqueline, you can correct me if I'm wrong, but one of the things that I know some medical people have said is that they have been taught that African Americans perceive pain differently. And so, you know, I'm not a medical professional, but I can tell you for sure that is not true. And so having those conversations where we are asking medical professionals, as we pray for them to get through their, serious vetting, to unlearn things like that. So that's what I would say, unlearn the racist policies and racist education in what you are learning as you learn how to heal and save lives, because that pain perception can kill. If you don't believe that this person is experiencing pain in the same way someone else is who is not Black, then that can, pain, except for in childbirth, pain is usually an indicator of something wrong. And so if you don't believe that there is something truly wrong because you don't think that their pain is accurate, then that can be deadly.
Yeah, I do agree, Eric. Pain is what we say is objective, and it's tailored to the person. But pain is pain, and we all feel pain. And and I like that analogy there. um, but I think investing in our providers or healthcare, what we have done is we do partner with a doula company. I can't think of the name, but we do. We allow moms that may want a doula to come and help.
Isla doula.
Dollar doula, that's right. I knew it was simple. Yeah, dollar doula. Yeah, so we are partner up with them. We help just we I know that when a doula's in my room, I help partner with her. Because number one, she's going to be with my patient a lot more than I am. So I'm going to collaborate care with her. I'm going to pour into her and her pour into me, vice versa, because she's been knowing this patient longer than I have, because they probably may have built a rapport outside if she's her own personal doula. Or if a doula comes in, again, investing in people to give good care is a plus. It comes through knowledge, it comes through teaching and training. Investing in people is a good thing, but people have to want to also invest in themselves. Healthcare providers need to invest in themselves. If they're giving care to African Americans, they need to look into what it is in giving that kind of care. And what it looks like to give an African American mother care, because the best thing again is to ask. The other day, I was in a leadership class, and this question came up, and it was a Caucasian woman who asked this question. She said to me, or to the crowd, and her question was, how could she, as a white provider, learn a Black person or learn a Black woman? Or and my thing was to her is to be authentic, and I think we put that somewhere in the comments. If I'm going to teach a white person about who I am, then I'm going to be authentic to Jacqueline, because that will teach her how to handle me. And that's how you look at it when you're caring for a patient. You go in to want to get to know them. And again, that's about putting some of your biases to the side, but also just making sure that you're listening to this patient, you're interacting with this patient, you're allowing this patient to be free. I think those things matter the most. And when we pour into one another like that, and we're educating, and then and I want to say this, also educating yourself. I think as me, as a nurse, when I was going into my patient's room, I wanted to know, and because I wanted to be able to give my patient the answers or the comfort that they need in my answers, to make sure that they know that and understand that this is the plan of care, and that they're acceptable to it and they understand it. That is big key. You're muted.
Just because, I'm talking, you were talking. Thank you. One more thing, just for the investment, literally, for doulas, for midwifery care, if it's not in a hospital, literally invest. I know that Birth Detroit, if you are getting care from Birth Detroit and you want a doula, they will provide for you a doula free of cost. Shower gifts before you get an expensive snoo, or do reveal parties, invest in a doula. Invest in that person who's going to be able to provide support. And that might mean, I had a client whose family gathered up their coins and bought me as a doula.
Oh, wow.
Birth and postpartum. Did she get other things? Yes, she did. But what they really wanted to do was invest in her by investing in me.
Nice.
And I was a shower gift. And so literally that's how they invested.
I love that.
I
Thank
do
you so
too.
much. Yeah. And thank you again for like clearing up the definition for me. Again, it just
No,
kind
it's
of
okay.
show like the education really happens in settings like these. So just
I didn't
saying.
even know what a doula was 5 years ago, even though I've been doing it for 30 years. I didn't know what it was. So you are smarter than I was.
Yes, the wisdom. Yeah, so many wise wisdom words.
Yeah.
I know that we're getting close to the end, and as much as I loved going back and forth with you two ladies, I wanted to open the floor to anybody in the audience who had any questions. If you wanted to raise your hand or put it in the chat, I can read them out. But if not, if Jacqueline and Erica wanted to have any last words.
You're the future. I am very confident because of this right here. These questions, I'm sitting here like, okay, I gotta think. I have to think. They were a little intimidating, and that is exactly what they should be.
Exactly.
Because iron sharpens iron, and you you make me think critically. That is what needs to happen. So I am so confident in the future, these people who are going to be birthing, because of what you are doing and who you're holding space for. So I'm grateful and I'm honored, and I just want to sit here and take Jacqueline out to dinner so I can sit up here and learn more about all of her. I'll get my pin card to take you to the cap. No, I'm just kidding.
Erica, we will get together because we have just built this bond over this
I know.
last week. So we will get together. I am so grateful to have been on this panel. This was my first panel. I actually moderated a panel the other day, and that's where I met Erica. But this is my first time ever sitting in on something so magnificent and so well needed. And again, I agree with Erica. I'm just looking forward to the future, what you all are going to bring. One thing I love about you young people is that you guys you're breaking barriers down. Um, and you guys are not afraid to use your voice, and you're not afraid to stand up for what it is you believe and want in equality. So with that being said, I am glad and honored to be amongst you all, because you guys are going to make me better, make me use my voice, make me bring more awareness, and want to pour out my heart to you guys, because I chose this field because I became a teen mom. Even though I only have a few years in labor and delivery, it was always my intentions to come back and help a community of Black young mothers, because I remember how it was to be a Black, or I remember, and I am still a young Black single mother. And I know the struggles, and I know how it feels not to be heard. I know how it feels to be stereotyped. I know how it feels to be overlooked or misunderstood, or to be looked at as if you're uneducated or you're not intelligent. So I'm just hoping that this continues to grow me so I can pour out into others and make a difference and continue to bring awareness. So again, thank you all for the invite. And we, the Ann Arbor National Black Nurses, we appreciate you all.
Yes. There's just one more question that I see in the chat from Jared, and it said, what are resources for young teen parents who might be expecting?
Good question. Eric, I can't hear you.
Sorry, I was actually typing a response to that. And I'll put it in there, but like Birth Detroit, the Corner Health Clinic, Motor City Doula Association, Black Mothers Breastfeeding Association, and that's not it. But these are organizations that have support workers who center the community. So whatever your age, you have people who are in these organizations who are there to say, hey, tell me tell me about you. Just like Jacqueline said, these are people these are organizations with individuals whose goal is to build relationships with people so that they can give you the experience of your dreams, no matter your age.
Yep. And just to add one more to her list, Our Village is also another resource for
That's
young Black mothers.
That's right.
Yep.
Our village, that's Melissa, right?
Yep, that's Melissa and Melissa Scott and Latricia Wild.
Yep.
So, yep, very good program for people to look in. Well, excuse me, Black mothers, young mothers to look into.
And so, yeah, so I just wanted to put that in there so that you would know, and you can look them up. And like I said, you're gonna find birth support workers there who are there to center community and give you the embrace and radical love on that journey, no matter what it looks like.
Yes.
Thank you so much for the resources. Honestly, Jacqueline, I'm surprised you said this is your first panel. You did amazing. And I'm
Thank
surprised you
you.
guys don't know each other, because I was like the bond is just the vibes
Yeah.
are.
That's called sisterhood.
That's right.
Mhm.
And that's what you find in this community. You meet once, you have a common goal, and all of a sudden it's like, yep, we're holding hands and we're all going in the same direction.
Yes.
Absolutely. Absolutely. Thank you again. And just kind of echoing everybody in the chat, just showing so much love for you too.
Thank
And
you.
we all just thoroughly enjoyed being here and spending the evening with you, just gaining wisdom from you. And I don't know if anybody else had any closing words, but if not, we can end off the panel.
Well, thank you to everyone. And if you ever need to have or need information, I am at the VVWH Birth Center. You can ask anyone or look me up in the system, and I am there.
I'm putting my email in the
Oh,
chat.
I can do that too as well.